Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Well, it's a pretty nice day out there today, Charles. Sun's shining and skies are clear. We should be out there, instead of cleaning your teeth, we should be out there playing golf or enjoying the sunshine, maybe even playing tennis. It'd be a good day to do this. Maybe we'll do it after we finish cleaning your teeth. What's wrong here, Charles? What's wrong?
I feel so good.
Oh, why don't we loosen your tie up? Hey, Rod?
Yeah, Bear.
I think we need some help over here.
What's the matter?
Oh, my patient's having a little trouble breathing. You get me an instructor?
Yeah.
Come on, Charles. You're in good hands here. Why don't you just relax and take some real deep breaths for me? Take some real deep breaths. Loosen this tie up again, a little more. Just relax now, Charles. Just relax. Take some deep breaths.
Sure, what's the trouble?
Oh, we're having some difficulty. Patient's breathing pulse is real thready.
I don't detect any carotid pulse. All right, we'll proceed with closed chest cardiac massage and mouth-to-mouth resuscitation. Begin with 4 ventilations and then 1 for every 5 chest compressions. 1,000, 2,000, 3,000. Would you call the desk and have them sound the code alert for this cubicle in this clinic and pick up the emergency kit? 1,000. 2,000, 3,000, 4,000, 5,000, 1,000, 2,000, 3,000, 4,000, 5,000.
We've got a code alert on the 2nd floor, Senior Green Clinic, 253. Right, Dr. Snyder's requesting a code alert, Senior Clinic, 253. Okay.
Code alert, cubicle 253, Senior Green Clinic.
The student is asked to pick up the emergency kit, oxygen mask, and backboard.
1,000, 2,000,
Here's the
3,000,
ambu bag.
4,000.
There.
5,000, 1,000, 2,000, 3,000, 4,000, 5,000, 1,000, 2,000, 3,000, 4,000, 5,000.
Make sure his airway is
5,000.
patent.
About 2.5 minutes of
His pupils are good. He's getting, he's well oxygenated. Has anyone called for an ambulance?
directions.
Would you have someone send for an ambulance and then alert the emergency room at the hospital that there is a cardiopulmonary arrest on the way? I think we better get an IV started while we can. You're being real effective. He's nice and pink.
Ambulance is on its way.
Code alert, Cubicle 253, Senior Green Clinic.
Mrs. Warzinski, would you call Mrs. Brown and have her discontinue the code alert, please? Give me the end of it. Just give me the end of the tubing. Atta boy. Did you do it? Give me another piece of tape, please. Let me hold the bottle while you get it.
I just heard you call. May I help?
Yes, Dr. Gobetti, would you please record some events and times?
Would someone run and get a IV stand, please?
I'll get that.
All right, I arrived at the scene at about 1:30. There were no signs of breathing and a very thready pulse. We initiated mouth-to-mouth and external heart compressions. The code alert was given. Dr. Bonnet arrived at the scene 2.5 minutes approximately after that time, assessed the patient's condition and prepared for the IV.
Instruct the ambulance to arrive at the North University entrance beneath the library. Someone should be assigned to meet the ambulance at the entrance.
Constricted, Dr. Gobetti.
Here comes the ambulance.
Color's good.
I'll get the elevator ready.
You'll be ready to move in again, Van. All together. Easy does it.
Over here now.
We have just shown you a simulated cardiac emergency. In this presentation, we have demonstrated three things. First, we've demonstrated how quickly an emergency can develop and how fast one must react to it. Second, we've shown you the immediate steps which must be taken in order to maintain the victim's life. And third, how uncomplicated this can all be if you are prepared and if an air of calmness is maintained. Fortunately, emergencies such as the one just demonstrated do not happen often. But if and when they do occur, your patient's life will depend on how quickly and efficiently the resuscitation procedure is begun and administered. Therefore, it is essential that you know the emergency procedures which have been demonstrated. Our purpose, then, is not to teach the technique of resuscitation, but to familiarize you with these emergency procedures. First of all, one must recognize and determine that there is an emergency. When the patient shows signs of distress and pain, or his breathing or heartbeat becomes irregular, you obviously have an emergency situation developing and must immediately call an instructor for help. Send the nearest student or dental assistant for an instructor. He should also get the emergency kit and oxygen at this time, or while the code alert is being sounded at the direction of the instructor. Check your patient. It is the student's responsibility to make a preliminary diagnosis and begin the initial resuscitation. If the patient is unconscious without respiration or pulse, the student must start pulmonary ventilation procedures immediately and not delay until an instructor arrives. Begin external cardiac massage coordinated with mouth-to-mouth resuscitation. If no assistance is available, the student must continue mouth-to-mouth resuscitation and external cardiac massage by himself until help arrives. And this should be done at a 5-to-1 ratio. That is, 5 chest compressions for each chest inflation with mouth-to-mouth ventilation. Remember, you're trying to deliver oxygenated blood to the brain in the shortest possible time and with a continuous supply in order to sustain life. As a matter of fact, you have only 2 minutes between unconsciousness and when the victim needs oxygenated blood to his brain. His life depends on it, and irreversible brain damage may occur if there is delay. If your patient is conscious and still breathing, but is in distress, as he was in our simulated emergency, place him in Trendelenburg position and make him as comfortable as possible. When the instructor arrives, he will determine whether or not to sound the code alert. We'll repeat that scene of our simulated emergency with a superimposed digital counter to show you how much actual time elapsed between when the patient became unconscious and when resuscitation began. The counter will start when the patient loses consciousness.
Sure, what's the trouble?
Oh, we're having some difficulty. Patient's breathing, pulse is real thready.
I don't detect any carotid pulse. All right, we'll proceed with closed chest cardiac massage and mouth-to-mouth resuscitation. You do the ventilations, I'll do the chest compressions. Begin with 4 ventilations, then 1 for every 5 chest compressions.
As you can see, it took 46.9 seconds to begin resuscitation efforts on the patient once he lost consciousness. There must be a smooth transition between the persons who are sustaining life by the emergency resuscitation procedures. The person with the most experience with cardiovascular emergencies should assume command and direct all resuscitation efforts. This brings maximum confidence and calmness in the resuscitation situation. If the student is being effective with his resuscitation efforts, he would continue those efforts until someone with greater experience can take over. And once resuscitation has begun, it must be continued without interruption until the patient is revived or until he is placed under medical care at a hospital. Note that the procedure stopped just long enough to place the patient on the stretcher, and they quickly resume and continue as the patient is taken to the ambulance. Even inside the ambulance, the resuscitation must continue. During an emergency, someone should be assigned to record all details of time, responses, medication, and events for later reference. It is the responsibility of the person in charge to decide whether an IV needs to be established, whether or not an improvement of the airway is needed, whether or not drugs are needed, and whether to call for an ambulance and notify the hospital of the patient transfer. Remember, it is the student's responsibility to make the initial diagnosis, to call for an instructor, and to be prepared to begin resuscitation efforts. The instructor will give the order to sound code alert. These responsibilities and the established sequence to follow in the event cardiac or respiratory emergency develop are outlined in the clinic procedure manual, along with all emergency telephone numbers. It is the responsibility of the student, the faculty, and others in contact with patients to be familiar with this information. There is no substitute for being prepared.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.